So you lock it. Lock the knee straight. You hear that? Can you do it yourself? Okay, so after a short walk, some gait training, we begin with some moist heat to the quadriceps and the knee with neuromuscular E-stem to the VMO and the rectus femoris. The pad placement is as shown, during which Merrick will perform quad sets and active assisted short arc quads. While he's doing the quad sets, I'll be doing some manual therapy on his bottom of his foot. I'll get his toes moving. All this is in preparation for the knee flexion stretch. This is a foot splint. They're trying to wear it all the time, I think, right?
As much as possible.
As much as possible, and that's going to help keep the toes from flexing during the correction down here, down low. Which the tendency here is to get tight plantar fascia, tight heel cord, tight gastroc, all those tissues. That's why in a moment I'll be doing some soft tissue work here on the bottom of the foot. A lot of that is for just general comfort, but also for some flexibility in the toes, which they look pretty good right now. But again, as the correction proceeds, we would expect that to become a little tighter. We hope it doesn't, but we do everything we can to manage it, to keep it flexible. Not only this is some soft tissue work good for the bottom of the foot for flexibility, but also for sensation. Since he is not weight bearing through his foot, he's weight bearing through the foot plate here. He's not getting the tactile sensation that you and I get when we press on the floor and put our weight through our leg. Therefore, the tendency would be that if we let that be and not have any touching or rubbing down here, it would become actually very hypersensitive. So that's just another reason we do it. And then again, some toe range of motion. I get a little massage in there. We go each toe. Again, just with the goal to maintain the flexibility. And again, as the correction continues here on the lower leg, the tendency would be that the posterior musculature would become very tight. We're trying to avoid any of that. Okay, so now we are putting a bolster beneath the knee. This is serves two purposes. Again, the E-stem is still on with about 6-7 minutes remaining. This serves a purpose of progressive knee flexion. So we let it down slowly, but I'm not bringing it down all the way on the first one. But progressively, we're able to get it down during this 6 or 7 minutes. Usually, get it down so that he's in a flex position, so that this part of the fixator is on the bed. While it's on, he is helping me kick up, and you're kicking it up. Scoot over here. Hold it up for me. And he is really, right now, he's profoundly weak in that quad. Specifically, the VMO is why we stimulate it for the terminal knee extension. That will help him progress his ambulation and his ability to hold his own weight without, hopefully at some point, without an assistive device. So this is on a 15-second hold, I think. Hold it up now, you gotta work now.
What is this song?
And then we let it down a little bit longer, you gotta relax.
Almost 2.
He needs a lot of cueing for breathing, relaxing, participating. And now it's on again. Now you can kick up. Another thing we do to assist with the knee flexion stretching is patellar mobilization. Certainly laterally, to make sure, and it's a bit bound down right at this moment. I get it going side to side. You can use a towel or a washcloth for traction. good. Get your grip a little better. And first I get it moving laterally. It should come very quickly. And then inferior moves will be most beneficial to Merrick because when the quad tightens, the patella tends to ride up a little higher and kind of bind a bit alta or high, which causes discomfort at the knee. So it's helpful to keep the kneecap mobile so that it kind of moves inferiorly as it should when you bend the knee. So here I'm pushing it down. It's pretty mobile going that way right at this moment, but as the lengthening progresses, we do expect the quad to become tight. Well, hopefully not, but the kneecap, the patella might ride up some. And he may lose range of motion. Currently, he hasn't lost any range of motion as yet. Now we're trying. Come on, save it. Okay, so we do, it's very supple right now. There's not a lot of tone here in the quad. That's all that's good for Merrick, it's good for us. Which means his only hindrance now is really his own anxiety, his own guarding. Which we're at the beginning, at the early stages of the lengthening as it is now, we are working a great deal on learning to cope with the stretch, with the anxiety associated with it, deep breathing, all the things that we do to that we can do to help reduce his anxiety as it pertains to the stretch, which is painful. There's no doubt about it. To get in that prone position and just being in preparation for the stretch. We usually do it at the end. He becomes very anxious, but it only lasts a minute and a half. That's one way only a minute and a half, right? 30 seconds each one. And he has full range of motion. He's been like easily 90 or beyond whatever the fixator allows right now. He's been getting up to. The fixator does block right now at about 90 degrees of knee flexion. We'll show that in the prone position when we finally do the bend. But again, we are progressing. After this, we'll do some dangling. We'll do a Thomas position stretch for the hip flexor, and also in preparation for prone positioning and the knee flexion stretch. When I do massage on the quad, it's important that we go kind of a up and down motion rather than side to side. Going side to side will pull on the skin around the pin, certainly also in a circular motion, and we want to keep that very comfortable for him, not adding to his pain or certainly his anxiety. We want him to enjoy the massage and want it to feel good and prep him with relaxation for the stretch. So near the pins without getting lotion near the pins, of course, because it does tend to kind of get a little tight around the pins. Certainly the hip adductors are very supple as well at this point. That's good. So again, we're here. As we see, we haven't moved yet, but the anxious behavior, which can fool you into thinking it's pain behavior, it's really not. It's anticipating pain. We're gentle as we can be. Again, I'm using a fixator. We're lowering it down. We encourage him to help by putting his hip down and even leaning over this way. Remember this? Reach over here. And that helps to keep his hip down. And we'll gradually bring it down and do a dangle position. He hasn't been here in a few days, so sometimes the carryover isn't there if we don't do it every day.